You went to the doctor, maybe because you felt a strange discomfort, or perhaps you noticed a lump that wasn't there before. You had an ultrasound, and then came the diagnosis: presence of an inguinal hernia. For most people, the immediate reaction is almost always the same: anxiety, followed by the big question: do I really need to operate? Do I need surgery right now, or can this wait? Is it true that every single hernia requires going under the knife? And perhaps more importantly, what actually happens inside your body if you decide to do nothing? What are the real risks of just ignoring it? Today, we are going to break down exactly what happens within your anatomy when you receive this diagnosis. We will discuss when surgery is absolutely mandatory and when it might be safe to wait. Furthermore, we need to talk about the critical mistake that causes many people to worsen their condition without even realizing it. Before we dive into the solutions, we need to establish exactly what an inguinal hernia is. You have likely heard of different types of hernias: umbilical, epigastric, incisional. But the inguinal hernia is specific. It happens when part of the intestine or abdominal tissue escapes through a small weakness or a hole in the muscle wall of the groin. Think of your abdominal wall like the tire of a car. If there is a weak spot in the rubber, the inner tube might start to bubble out under pressure. That is essentially what is happening in your groin. There is a breach in the muscular layer that holds your internal organs in place. This is why the most common symptom is a visible bulge or lump in the groin area. You might notice it appears more prominently when you stand up for a long time, when you cough, or when you lift something heavy. It often feels like a pressure or a dull ache. A defining characteristic of this condition is that the bulge can come and go. When you lie down and relax, gravity helps the tissue slide back inside the abdomen, and the lump seems to disappear. This leads many people to believe that the problem has gone away or healed itself. This is a dangerous misconception. A hernia is a mechanical defect. It is a physical hole in the muscle. It does not heal like a cut on your skin. It does not close up on its own. The bulge disappearing simply means the contents have slid back in temporarily, but the door remains open. To truly fix that door, you will invariably need a procedure. But why does this happen in the first place? Why did this wall weaken? There are several factors that facilitate the appearance of an inguinal hernia, and understanding them is key to managing the condition. The primary culprit is increased intra-abdominal pressure. This includes repetitive physical effort. If your job or your workout routine involves heavy lifting or intense straining, you are putting massive pressure on that abdominal wall. Over time, it can give way. Another major factor is chronic constipation. People who have to strain significantly to have a bowel movement are forcing that pressure downwards into the groin area every single day. Similarly, urinary issues are a common trigger, especially in men. If you have an enlarged prostate or benign prostatic hyperplasia, BPH, and you have to force the urine out, that straining is directly stressing the inguinal canal. We also have to look at chronic coughing. People who smoke or suffer from chronic lung conditions create violent, repetitive pressure spikes in the abdomen every time they cough. And finally, there is biology. Some people simply have a genetic predisposition. You may have been born with a slightly weaker connective tissue or a patent process in the groin that makes you more susceptible than others. It is often a combination of these lifestyle factors and your natural anatomy. So, you have the diagnosis. You know why it likely happened. Now, what is the danger of not treating it? This is the part that isn't discussed enough. A hernia can exist for years without causing catastrophic problems. You might live with a small bulge that is just a nuisance. However, the situation can change from a nuisance to a life-threatening emergency literally overnight. The biggest and most feared complication is what we call strangulation. Remember that hole in the muscle wall? The intestine slides in and out of it. But sometimes it slides out and gets stuck. It becomes trapped. This is called incarceration. If the hole is tight enough, it can cut off the blood supply to that piece of intestine. That is strangulation. When the blood supply is cut off, the tissue begins to die. This is necrosis. If that happens, the bowel can perforate, leading to severe infection, sepsis, and yes, it can be fatal. This is a surgical emergency. It requires immediate intervention, often involving the removal of a section of the intestine, and the recovery is much harder and riskier than a planned repair. Your body will usually warn you if this is happening. You need to know the red flags. If you have a hernia and suddenly develop continuous, intense pain that does not go away, if the bulge becomes hard, red, or tender to the touch, if you cannot push the bulge back in when you lie down, or if you start experiencing nausea, vomiting, and abdominal bloating, do not wait. Do not look for home remedies. You need to get to an emergency room immediately to be evaluated by a surgeon. However, not every case is that dramatic. This leads to the question most patients ask, but what if my hernia is small and it doesn't hurt? Do I still need surgery? The truth is, not every hernia needs to be operated on the very next day. There is a concept in medicine called watchful waiting. In specific cases, where the hernia is small, creates no symptoms, causes no pain, and does not interfere with your daily activities like walking, working, or exercising, it might be reasonable to simply monitor the situation. You don't necessarily need to rush into the operating room if the risk of immediate complication is low. But there is a catch. Watchful waiting implies that you are actually watching it, ideally under the guidance of a professional. You cannot simply ignore it. Furthermore, you must accept the reality of the condition. Hernias tend to get bigger over time. Gravity and pressure are constant forces. The hole rarely stays the same size, it expands. For men, there is a specific progression that can make things complicated. If an inguinal hernia is left untreated for a long time, the intestine can descend all the way down into the scrotum. The scrotum can become significantly enlarged, sometimes reaching massive proportions. We call this an inguinascrotal hernia. When it gets to this stage, surgery is no longer a simple, standard procedure. It becomes technically difficult and carries higher risks. You have moved from a simple repair to a complex reconstruction. So, while you can wait in some cases, you generally cannot wait forever. The goal is to repair the defect before it dominates your life or becomes an emergency. So, when the time comes, what does the solution look like? Surgery for inguinal hernias has evolved tremendously. It is no longer the terrifying ordeal it was decades ago. Today, we have options ranging from traditional open surgery to minimally invasive techniques like laparoscopic surgery and robotic surgery. Regardless of the method, whether the surgeon makes one incision or uses tiny holes and a camera, the objective is the same. The goal is to return the abdominal contents to where they belong and repair the defect in the wall. In modern surgery, we rarely just stitch the hole shut because that creates tension on the muscle, which is painful and prone to ripping open again. Instead, we almost always use a mesh. This is a sterile, synthetic net. Think of it like a patch on an inner tube. The mesh is placed over the weak spot to reinforce the abdominal wall. It acts as a scaffold. Over time, your body's own tissue grows into the mesh, creating a strong, integrated barrier that prevents the hernia from coming back. It is a highly effective, permanent solution. The procedure itself is usually quick. Most patients go home the same day or the following morning. It is an outpatient procedure for the vast majority of people. However, the fact that the surgery is quick leads us to the recovery phase, where patients often make critical mistakes. Because modern techniques like laparoscopy and robotics cause less pain and leave smaller scars, patients often feel deceptively good very quickly. You might feel ready to conquer the world just a few days after surgery. This is a trap. The tissue inside needs time to heal. The mesh needs time to integrate with your muscle. This process takes biological time, usually between 4 to 8 weeks, regardless of how good you feel. If you return to heavy lifting, intense gym workouts, or heavy physical labor too soon, you risk disrupting that repair. You can force the mesh out of place or tear the healing tissue, causing the hernia to recur immediately. You have to respect the biology of healing. There is another massive error that leads to recurrence, and this goes back to the causes we discussed earlier. You must treat the root cause of the pressure. If you have the surgery to fix the hernia, but you continue to smoke and cough violently, or you continue to strain due to an untreated enlarged prostate, or you ignore your chronic constipation, you are setting yourself up for failure. The pressure that caused the first hernia is still there. It will find the next weakest spot, or it will blow out the repair you just went through. Successful treatment isn't just about patching the hole, it's about managing the lifestyle and health factors that created the hole in the first place. And speaking of addressing those root causes and maintaining peak male health, if you feel like your body isn't recovering the way it used to, or you're struggling with blood flow and vitality, you need to see this. There is a bizarrely simple, 7-second natural purple tonic ritual that thousands of men are using to rejuvenate their bodies and restore rock-hard firmness without dangerous pills. If you want to stop relying on temporary band-aids and fix the foundation of your manhood, point your phone's camera at the QR code on your screen right now. It will take you to a special video explaining exactly how this natural home remedy works. I have also pinned the link in the top comment below. Check it out to see how you can unclog the hose naturally. To summarize, no, not every hernia requires emergency surgery the moment it is diagnosed. If it is small and painless, you may have time. But you must understand that this is a progressive condition. It does not fix itself. It has the potential to grow, to descend into the scrotum, or to strangle, which can be fatal. The do-nothing approach is a gamble. The watchful waiting approach is a strategy, but it requires medical supervision. Eventually, the only definitive cure is surgery to place a mesh and reinforce the wall. There are no exercises, no pills, and no belts that will close that hole. If you see products online promising to cure a hernia naturally, be very skeptical. Anatomy does not work that way. If you have been diagnosed, find a surgeon you trust. Have a conversation about your specific risks. Make a plan. It is always better to operate on your own terms when you are healthy and prepared than to be rushed into surgery at 3 a.m. because of an emergency complication. Take control of the diagnosis before it takes control of you.